Hi, Ms. Toth. My name is Kelsey. I'm a physician assistant student. I'm going to be taking a history and then doing a physical exam, okay? So why don't you tell me what brought you in here today?
I've been waking up a lot during night, like disturbed sleep, and a lot of it's from this very loud snoring.
Okay. And how long would you say this has been going on for?
About like 8 months.
8 months. Okay. All right. So since this is our first visit, I just want to get to know you a little bit better. So why don't you tell me about yourself? Do you work? Are you married? Any kids? Anything?
I'm 46.
Okay.
I'm an accountant. I'm divorced.
Okay. How long ago was that divorce?
Like 8 years ago.
Okay.
I don't have any kids.
Okay. How would you describe your general health?
I'm good.
Okay. Good to hear. And what is your ethnicity?
Caucasian.
Okay. And how would you identify your gender?
She, her, and hers.
Okay. And have you had any hospital admissions in the last 6 months in reference to this disturbed sleep and snoring?
Mm-hmm.
Okay. And do you have any past medical conditions relating to this?
No.
Okay. So you said this began about 8 months ago?
Mm-hmm.
So why don't you, starting 8 months ago when this very began, just tell me everything.
I started to notice that I've been waking up periodically while asleep.
Okay.
And oftentimes I'll wake up gasping for air, as if I wasn't breathing.
Okay.
And then my snoring has gotten louder. My roommate tells me now she can hear me from her room.
Okay.
So that's been getting worse. And then I'm having more daytime sleepiness also, I noticed during my job.
Okay. I'm sorry to hear that. That must be getting really frustrating for you. It's been going on for a while. So 8 months ago when this began, was there any sort of event or anything that may have caused this to happen? Did you notice anything in that time frame?
No.
Okay. And is there anything you've been doing to try to make this any better?
I notice when I sleep on my side, it's
Okay.
not as bad. But if I sleep on my back, the snoring's a lot louder.
Okay. Is there anything else that makes this worse?
Not that I know.
Okay. And have you been taking anything for this or trying any alternative treatments?
No.
Okay. And you said your snoring has gotten louder. What about the disturbed sleep? Has this been getting worse over the last 8 months, or
It's
constant?
periodically gotten more frequent. That I'm tired during the day because I think I wake up more at night.
Okay, so the amount of times you wake up throughout the night has gone up in the last 8 months. Okay. And has the daytime sleepiness gotten worse with that?
Yeah.
Okay. And the snoring has gotten more intense. You said your roommate can now hear you?
Yeah.
Okay. And she couldn't in the very beginning, like when this first started
No.
happening? Okay. And has anything like this ever happened prior to this 8 months ago?
No, I don't remember anything happening.
Okay. Is there any pain associated with this?
Not necessarily, just the gasping for air.
Okay. That's just probably scary when you wake up.
Yeah.
Okay. And do you feel any tightness in your chest or difficulty breathing throughout the day?
Mm-mm.
Okay.
No, it's just at night.
Okay. So this is just at night. Okay. Do you have any other symptoms along with the gasping for air, snoring, and daytime sleepiness?
I wake up often with a dry mouth.
A dry mouth. Okay. And this happens after a night of waking up with snoring. Okay. And has the dry mouth been getting worse?
It's about the same.
Okay. And this started the same time, about 8 months ago?
Yeah.
Okay. Okay. I'm just going to ask you a series of questions regarding your disturbed sleep. So has there been any cough associated with this?
No.
So no sputum coming up, nothing when you're gasping for air?
Mm.
Okay. Have you experienced any wheezing throughout the day or when you wake up at night?
No.
Okay. Any shortness of breath other than the
No, just the gasping.
list? Yeah. Okay. Do you have any pain when you take a deep breath?
Mm-mm.
Okay. Have you ever gotten a chest x-ray done?
I don't think so.
Okay. Do you have any history of asthma
No.
or bronchitis,
No.
emphysema?
I have CHF.
Okay. And how long ago was that diagnosis?
5 years ago.
5 years ago. Okay. Are you currently doing anything for that, or are we just monitoring it?
Yeah, we're just monitoring.
Okay.
It's not.
Okay. And any pneumonia, history of pneumonia, or tuberculosis? Okay. So you've been experiencing fatigue, you said. Any weakness?
No, just like along with the I'm just tired.
Okay. Any fever?
No.
Any weight changes?
No.
So your usual weight?
Mm-hmm.
Any clothing that fits more tightly or loosely than usual?
No.
Okay. To get a better picture of everything that's going on, we're going to go way back and start with your history from your childhood. So how would you describe your health as a child?
Oh, it was good. I don't remember any intense illnesses that I had or remember hearing about.
No chronic conditions as a child?
No.
Okay. Were you ever diagnosed with measles?
No.
Mumps?
No.
Chickenpox?
No.
Rheumatic fever?
No.
Scarlet fever?
No.
Polio?
No.
Or any psychiatric disorders?
No.
Okay. Thank you. And then regarding childhood vaccines, did you remember if you got your polio vaccine?
I believe so.
Your MMR?
Yeah,
Your Haemophilus influenza type B?
I think so.
Okay, that's okay. Tetanus?
Yeah.
Diphtheria?
Yeah.
Pertussis?
Yeah.
Rotavirus?
Yes.
Hep B?
Yeah.
Chickenpox?
Yeah.
And pneumococcal? Great to hear. Okay, so childhood health looks good. We're going to move into your adult health. So have you ever been diagnosed with any of the following things? Any thyroid disease?
No.
Heart disease other than the congestive heart failure?
I have hypertension also.
Okay. And how long ago was that diagnosis made?
4 years ago.
Okay. And do you take anything for that?
I take lisinopril.
Okay. And do you know the dosage of that?
20 milligrams.
And how often is that taken?
Take it once a day.
And is it a pill you take? Is it a...
Yeah.
Okay. Is that it for heart disease? Congestive heart failure and hypertension?
Yeah.
Okay. Any hyperlipidemia?
No.
Cholesterol? Okay. Any diabetes?
Yeah, I have type 2
You
diabetes.
have type 2 diabetes, okay. And when was that diagnosis made?
6 years ago.
And are you managing that with any medications?
I take insulin.
Okay. Okay. Any COPD?
Mm.
You said no to asthma already. Any history of cancer?
No.
Okay. Any HIV infection?
No.
Hepatitis?
No.
Kidney disease?
No.
Or blood clots?
No.
Okay, good. So for your diagnoses, you have hypertension 4 years ago, type 2 diabetes 6 years ago, and congestive heart failure 5 years ago, correct?
Yeah.
Anything else? Okay. Have you ever been hospitalized for any reason?
I broke my leg a few
Okay.
years back.
And do you know what year that was?
I think it was 2011.
Okay. That was about 8 years ago now. Which leg was it?
My left leg.
Okay. And do you remember what the fracture was? What bone you broke?
One in the lower leg.
Your tibia or fibula?
Yeah,
one of those?
one of them.
Okay. And what happened? How did this happen?
I fell down the stairs.
Oof. Sorry to hear that. And how was this corrected? Did you...
I got surgery.
Got surgery. Okay. And do you know where this surgery was?
Like
What
the
hospital?
Roxborough.
Okay. And this was also 2011. Do you happen to know the month or
I
date?
think it was May.
In May. Okay. And do you remember the name of the surgeon?
No.
Okay. That's okay. And how was your recovery? Any complications?
It was
or
good.
everything well?
Yeah,
Full
I think so.
recovery?
Mhm.
No problems since then?
No.
Okay. Any other hospitalizations?
No.
Okay. Any other accidents?
No.
Any other surgeries?
No.
Okay. All right, next I'm going to ask about your gynecological health. So we'll start with, do you remember when your first period was? Either how old you were or what year it was?
I was 12.
You were 12, okay.
So, long time ago.
Okay. And how many days does your period generally last?
About 7 days.
Okay. And how would you describe the flow?
It's normal.
Okay. And do you know how many days your whole cycle lasts? Is it generally around 28, 29?
I usually get like the same week every month,
Okay.
so I would say.
It's pretty average. Okay. Do you know when your last period was?
I think it was like 2 weeks ago.
Okay. Do you have any history of amenorrhea
No.
or dysmenorrhea?
No.
Do you know when your last pap smear was?
I think it was like 6 months ago.
Okay, great to hear. Was there any abnormal findings on this one or any pap smear in the past?
No.
Okay, that's great. And do you have any history of STIs?
No.
That's great. Do you have any history of pregnancies? Have you ever been pregnant before?
No.
No. Okay. And do you use any forms of contraceptive, whether they're oral or barrier methods?
Condoms.
Just condoms. No oral contraceptives or any other form of birth control?
No.
Okay. Perfect. And next I ask all my patients about their psychiatric history. So have you ever been given any psychiatric services or any diagnosis?
No.
No? Okay. Any history of self-harm?
Mm-mm.
And have you ever been admitted
No.
before? Okay. All right. Okay. Next, we're going to go into your immunizations as an adult. So, have you gotten your flu vaccine?
Yeah.
For this season?
Yeah, I got it.
Okay. Do you know when that was?
End of August. So
Okay. So sometime
like a
in
month
August. Perfect. Great to hear. You're ahead of the game. Did you get a Hep B vaccine?
Yeah.
Okay. Herpes zoster?
I don't think so.
Okay. Pneumococcal?
Yeah.
Okay. And then for screening tests, your last pap smear was 6 months ago. What about your mammogram?
I got it around the same time.
Same time? Any abnormal findings on that one or any in the past?
No.
Okay, good. That's great to hear. Have you gotten any colonoscopy testing done?
I had one about a year and a half, 2 years ago.
Okay. Any abnormal findings on that one?
Mm-mm.
Any in the past?
Mm-mm.
Okay, great. And have you gotten any tuberculosis testing ever done?
No.
Okay. Any cholesterol testing done?
Probably. I don't know.
No abnormal findings that you know of for cholesterol?
I don't think so.
Okay, great. Moving forward, we're going to talk about your family history, but first, so you take lisinopril, and do you take any other medications, herbal, multivitamins?
I take a multivitamin.
Multivitamin, is that every day?
Yeah.
Okay. Anything else that you know of?
No,
Is
the
that-
insulin.
Regarding allergies, do you have any food or medical
I'm
medicine
allergic to
allergies?
tree nuts.
Tree nuts? And what happens when you eat tree nuts?
My throat swells up.
Okay. Have you ever had any anaphylactic reactions?
No.
No? Okay. And when did you first learn about your tree nut allergy?
Like when I was a kid.
When you were a kid? Okay. Any seasonal allergies or allergies to medication?
Amoxicillin.
Amoxicillin?
I got a rash before.
Okay.
That was also when I was younger.
It's also childhood. Okay.
And I'll get seasonal allergies, just depending. They change.
Do you know what season? Is it generally fall or spring or varies?
Fall, sometimes I'll get like the stuffy nose.
Okay.
In the spring, I'll get the itchy eyes.
Okay. Are you experiencing any of the stuffy nose now?
No,
This
it
season?
has. It kind of.
Okay, that's good. Okay. So now to get a better picture of everything, we'll go a little bit further into your family history. So we'll start with just a general diagnosis. So has anyone in your family ever suffered from headaches?
No.
Okay.
I mean, we all get headaches.
Okay,
I don't,
but no like
not
chronic.
severe. No.
Okay. Any seizure disorders?
No.
History of stroke?
No.
Mental illness?
No.
Suicide?
No.
Substance abuse?
No.
Thyroid disease?
No.
Coronary artery disease?
No.
Any hypertension in the family?
My grandma had hypertension.
Okay. Any high cholesterol, hypolipidemia?
I think my grandma also had high cholesterol.
Same grandma?
It's my dad's mom.
Okay, so your paternal grandma?
Yeah.
Okay. Anyone else have a history of diabetes?
No.
Okay. What about asthma?
No.
Tuberculosis?
No.
Renal disease?
My uncle had kidney cancer.
Okay.
My mom's brother.
And what was the outcome of that?
Took it out.
Okay. So full recovery?
Yeah.
In remission?
Mhm.
Okay. Great to hear. Okay. Any other allergies in the family?
My sister's allergic to cats.
Okay. Any family history of arthritis?
No.
Okay. Any other cancer?
My grandfather had liver cancer.
Okay. And is that your mom
My-
or your dad's dad?
My dad's dad.
Okay, so your maternal grandfather had liver cancer. And what was the outcome of that?
He passed away.
Okay. I'm sorry to hear that.
Thank you.
Any other genetically transmitted diseases you know about?
No.
Okay. So, starting at the very top, your mom's parents, are they still alive or have they passed?
No, they passed.
They passed away. Do you know what from?
One was from natural death.
Okay.
My mom's mom.
Okay.
My mom's dad was in a car accident.
Okay. Do you know how old they were when these happened?
Mom's mom was 92. Mom's dad was 56.
Okay. And on your dad's side, your dad's mom and dad, are they still alive? Or?
No, they
Okay.
both passed.
And do you know what that was from?
Dad's dad
Mm-hmm.
was from the liver cancer
Okay.
at 79.
Okay.
Dad's mom was from natural causes, I think. I don't honestly know.
Okay. Do you know what age that was?
85, I think.
Okay. Do you know if they had any other major medical conditions or diagnoses?
Dad's mom had hypertension and the high cholesterol.
Yes.
And
On your mom's side, anything?
I don't, not that
Nothing
I know.
else.
Yeah.
Okay. So now with your mom and dad, is your mom still alive?
Yes.
Okay. Does she have any major medical conditions or diagnoses?
She sometimes has vertigo.
Okay. And how old is she?
She's 75.
Okay. And your father?
He's alive.
Okay.
He's 76. He has hypertension also.
Okay. Would you say they're both generally in good health, though, besides those
Yeah.
conditions? Okay. And now, so you've never had any pregnancies or kids? Okay. Okay. Now moving forward, we're going to go into your social history just to get a little bit better understanding of your environment and what kind of life you live on a day-to-day basis. So, Where were you originally born?
Scranton, Pennsylvania.
And where are you currently living?
In Philadelphia.
As a child, you said you were in good health. Did you feel safe at home?
Yeah, it was one of your typical childhoods. Played with some neighbors.
Was there any smoking in the house? Did you ever experience secondhand smoke?
My dad smokes.
Okay. Did he do this in the house?
No, sometimes in the car.
Okay. And what is your level of education? What was the last schooling that you attended?
I graduated college.
Okay. And was that with a bachelor's or?
A bachelor's. Master's, so sorry.
That's okay. Congratulations. And so you are currently an accountant. Did you have any other major jobs prior to being an accountant?
No, so
Okay.
just an accountant.
And you enjoy that?
Yeah, I like my numbers.
Okay. Your home situation. So, do you live in a house, an apartment?
I live in an apartment.
Okay. And are there any stairs in this apartment?
I live on the first floor.
You live on the first floor? Okay. Are there safety measures, like do you have a smoking detector?
Yeah.
Do you have a carbon monoxide monitor?
I don't know.
You don't know. Okay. Do you have any major sources of stress? Is your job very stressful or anything else in your life?
Sometimes my job can get so stressful. Sometimes I get lonely.
Okay. Do you have any history of military service?
No.
Okay. Financially, how would you describe your situation?
I'm good.
And what kind of leisure activities do you like to partake in? What do you do for fun?
Sometimes I'll go to the movies. Me and my roommate will go out for a nice dinner. I'll read. Sometimes I like to sew.
Oh, very fun.
Yeah.
What's your favorite genre of book?
That's a good question.
Put you on the
I don't
spot.
know.
Sorry about
that.
that.
I don't know.
I was just curious. I like reading too. Okay. Do you have any religious or spiritual beliefs?
I'm Catholic.
Catholic. Do you attend church or?
I like holidays.
Okay. Do you exercise?
No.
No exercise.
I'll go for walks.
Okay.
Slow walks.
It is recommended, 30 minutes of walking, even like moderate exercise a day, like 5 times a week, can be really good for cardiovascular health. It can help improve things like the hypertension you have, your congestive heart failure. It could help ease some of those symptoms to do some. So if you ever find yourself bored or you find some extra free time in your day, getting some exercise into a daily routine would be really beneficial for your health. And your food, what would you say a normal day looks like? What do you eat for breakfast, lunch, or dinner?
Breakfast, I'll have cereal.
Okay.
Sometimes make some eggs, toast. Lunch, sometimes I'll get like Subway if I'm out, or I'll bring a sandwich, maybe a bag of chips. Dinner, chicken.
Okay. Any vegetables or fruit in your diet?
Sometimes vegetables.
Okay. And what about your fluid intake? What kind of drinks do you drink on a daily basis?
I'll have like coffee in the morning.
Okay.
Maybe I'll have an occasional Dr. Pepper.
Okay. What about water? Do you hydrate throughout the day?
Yeah.
Okay.
Periodically.
Okay. And so how much coffee do you say you would have a day?
I have like a cup and a half-ish in the morning.
Okay. And how are your sleeping habits? How much sleep do you get on the average night?
Well, lately it's been like very low.
Okay.
So I'll try to like go to bed to get enough sleep, but then I'll be up for periods of time.
What would you say enough sleep is? Like, what is your goal every night?
Like 6 hours.
You aim for 6 hours. Okay. When you wake up at night, is it hard for you to fall back asleep, or do you usually fall back asleep pretty quickly?
It depends. Like sometimes, like if I wake up, like if it's like the gasping,
Okay.
then I'll like stay up for a little bit, and then after that I'll go back
Okay.
to sleep.
That's good.